This potassium is passed out of the body, causing a deficit. Sodium is also moved out and replaced by hydrogen. This increase in hydrogen ions only serves to make the acidosis worse. Vomiting is very common. This massive urination accompanied by the vomiting leads to dehydration and hypovolemic shock. Your patient has a net loss of potassium, but he or she may remain hyperkalemic. Look for EKG changes that include a longer than normal PR interval, a wide QRS, and tall peak T waves. Your patient may progress to having seizures. Generally, these patients are in a deep coma. Your treatment for them is limited to fluid replacement to try to offset the dehydration. We don't administer insulin pre-hospital. Doing so could lead to a rebound hypoglycemic. These patients will be admitted to the intensive care unit, and insulin will be administered over hours, if not days, in order to try to normalize their blood sugar levels. In hyperosmolar hyperglycemic state, as we said, known as HHS, glucose passes into the urine, causing severe diuresis. This results in the patient becoming dehydrated. In this disease, you'll often see blood sugar levels of 1,000 milligrams per deciliter or higher. Quite often, when you do a D-stick on your glucose monitor, it will simply read high. The difference here is that there's still enough insulin that's active to prevent your patient from metabolizing fat and producing ketone bodies. Your area of treatment for these patients is fluid replacement. These patients are truly in an emergency state, having a death rate as high as 70%. This may be because symptoms are very subtle in the early part of the condition and may only become apparent to the patient or family as your patient prepares to crash. It's normally seen in geriatric patients. Early signs and symptoms include increased urination as well as thirst. The mucous membranes become dry and sunken. Patients present an tachycardia. We will generally not see the Kussmaul's respirations because your patient's not as toxic. Treatment for HHS is fluid replacement and rapid transport to an appropriate facility. Thanks again for joining the 10-Minute.
All right, let's see if the first one will play.
You're listening to the 10-Minute Medic, the podcast for the busy paramedic student. I'm your host, Dr. Bill Young. This week's podcast will take a look at the pathophysiology of the endocrine system as well as a deeper discussion as to how it works. The pancreas lies just behind the stomach and is considered an organ of digestion. It's a small organ weighing about 3 ounces. It has both endocrine and exocrine functions. Endocrine refers to the delivery of hormones directly into the blood. Exocrine has to do with the delivery of hormones via specialized ducts. Hormones are used to regulate a specific action within an organ system. They function much like messengers from the brain with definite orders for cells to perform a particular action. They do this by acting on hormone receptor sites that may be on the outside or the inside of the cell. Hormone secretion is...
Yeah,